సో మనం ఇప్పుడు ఎండోక్రైనాల గురించి we are talking about endocrinology. Okay, in endocrinology we will discuss about so many hormones and the glands, their physiology and their pathology. So um, I'm Dr. Nikita and we are going through endocrinology now. So let me start. First of all, we'll get to know how many glands we have in the endocrinology. Number 1, pituitary gland. 2, thyroid. Parathyroid, which is behind the thyroid. In pancreas, there are endocrine cells like alpha and beta cells. Okay. Then adrenal glands, also known as suprarenal glands. Okay. Now we'll discuss about each and every hormone from the gland. Okay, from the gland itself. Now, first we'll go to pituitary gland. What is pituitary gland? It is also known as hypophysis. Okay, this is the pituitary gland, which is also known as hypophysis. Which is known as hypophysis. Here we have anterior pituitary gland and the posterior pituitary gland. Anterior pituitary gland also known as adenohypophysis, whereas posterior also known as neurohypophysis. Okay. In anterior pituitary gland, we have so many hormones like FSH or LH, which are known as gonadotropins, thyrotropins like TSH from the thyrotropes, ACTH, and growth hormone, prolactin. We have all these 5 hormones, including 2 more, that is beta endorphin and melanotropin. Okay, beta endorphin and melanotropin, which is also known as melanocyte stimulating hormone. Okay, so in all these hormones we have 2 subunits. Okay, alpha subunit and beta subunit. Alpha subunit is similar to all hormones, whereas beta subunit is specific to every hormone. Okay, now we have how should I tell you, derivatives of propiomelanocortin. Okay, propiomelanocortin derivatives. From this we'll get 3 hormones. You know, one ACTH, and the second is we talked about beta endorphin, and endorphin is nothing but one type of opioid, and melanotropin. Okay, so whenever, for example, in case of Addison's disease, you all know what happens in Addison's disease? Yes, correct. Decrease in cortisol levels. That leads to negative feedback to the hypothalamus, from which there is increase in ACTH to stimulate adrenal gland. Okay, because of this negative feedback. Along with ACTH, there is also production of melanotropin, which is also known as melanocyte stimulating hormone. Therefore, in Addison's disease and in some cases of Cushing's disease, in some case, because there are 2 types of Cushing's, in which ACTH is decreased in one, in which cortisol decreased, in which ACTH is high in one type, and in which only cortisol is high in one type. In the type in which there is high ACTH, in that also there is a pigmentation. Okay, so in Addison's disease we'll get skin pigmentation because of this propionocortin derivatives. Okay, this is all we know about the anterior pituitary gland. Okay, now neurohypophysis. Why we are calling it as neurohypophysis? Why? Because here what we have, hypothalamus. Okay, from this hypothalamus we'll have the tract. From here we have some nuclei. There is production of ADH and oxytocin. They will come through this tract, and here they will store in the posterior pituitary gland whenever there is a need, because of some phosphoreceptors, and that they will release ADH and oxytocin from the posterior pituitary. Okay, and we know the origin of adenohypophysis is oral ectoderm, whereas origin of neurohypophysis is neuroectoderm, because it is directly originating from the hypothalamus. Okay, neuroectoderm. Whereas this adenohypophysis, initially think this is the mouth and this is the roof of the mouth, will have a pouch known as Rathke's pouch, which in future develops into adenohypophysis. Therefore, this adenohypophysis is originating from oral ectoderm, and whereas from the hypothalamus it is extending as posterior pituitary. That's why posterior pituitary is neuroectodermal in origin. Okay, now we got to know the origin and all. So which nuclei secretes which hormone in the hypothalamus? For example, supraoptic nucleus. Okay, supraoptic nucleus, and one more, paraventricular nucleus. This supraoptic nucleus secretes ADH, whereas paraventricular produces oxytocin. Okay, how you'll remember this? Para मतलब प्यार, प्यार मतलब mom, mother, to the child. Secreted what? Oxytocin, you all know this, because during labor and during breastfeeding, what mother will secrete? Oxytocin. Even baby also have the same thing when she hugs her mother, or if she loves anyone, whatever. In love, you know that in love will get oxytocin released. Okay, so that is. So we all got to know what we discussed now. Endocrinology. In endocrinology, we are discussing each and every endocrine gland and their hormones, their functions, their physiology, their pathology. Coming to the point, what are the glands we have? Pituitary, thyroid, parathyroid, pancreas, adrenal. Okay, now we are discussing of the pituitary gland. In the pituitary gland, we have anterior pituitary gland and the posterior pituitary gland. Posterior pituitary gland is directly derived from the neuroectoderm, which is the extension from the hypothalamus. So it is derivative of neuroectoderm. Whereas anterior pituitary gland is developing from the oral ectoderm, that is from the Rathke's pouch, which is present in the floor on the roof of the mouth, oval cavity. So, what are the hormones produced by the posterior pituitary gland? ADH and oxytocin. But posterior pituitary gland itself is not secreting this ADH and oxytocin. It is not synthesizing, actually. It is not synthesizing these hormones. Hypothalamus have two nuclei, that is supraoptic nucleus and paraventricular nucleus. This supraoptic nucleus produces ADH hormone, whereas paraventricular nucleus produces oxytocin hormone. These hormones from the tract come to the pituitary gland, posterior pituitary gland, and store in the posterior pituitary gland and get released whenever there is a need. Whereas from the adenohypophysis, in the adenohypophysis we are having 5 types of trophs, group of cells. like gonadotropes, thyrotropes, corticotropes, somatotropes, like that. From the gonadotropes, we are getting FSH and LH, thyrotropes producing TSH, corticotropes producing ACTH, and somatotropes produces growth hormone and the prolactin. What we'll call for lactotropes producing the prolactin. Along with that, we also have two hormones from the single pathway, three hormones from the single pathway. That pathway is known as propiomelanocortin derivatives. From this pathway, ACTH, beta endorphin, and melanotropin all are produced together. That's why, in case of increased ACTH, Addison's disease, because of decreased cortisol levels, because of negative feedback, there is increase in ACTH production. Along with that, MSH is also produced that leads to the pigmentation of the skin. Okay, so we got to know, and few more points I want to add to this. So you know that FSH and LH are released from the gonadotropes present in the anterior pituitary, but to release that from the hypothalamus, we should get one hormone, that is gonadotropin releasing hormone, that stimulates the gonadotropes present in the anterior pituitary producing FSH. So GnRH is required for production of FSH and LH. The same way, for TSH production from the hypothalamus, we need to get thyroid releasing hormone, that is TRH. Like that, CRH, corticotropin releasing hormone for ACTH. Like that, for growth hormone, we have two hormones, gonadotropin. Oh, where should I write this? Okay, growth hormone releasing hormone and growth hormone inhibiting hormone. Obviously, releasing hormone stimulates the growth, inhibiting hormone inhibits the growth. You got the point. Like that, for prolactin, we'll discuss each and every hormone. At the time, I'll tell you about the prolactin. So all this is about the introduction for the pituitary gland. Now we'll talk about each and every hormone from the pituitary gland and their physiology and pathology all together at once. Okay, this is Dr. Nikita signing off. Bye.